The following segment is sponsored by Northern Nevada Health System.
We are here with Kevin Flynn. He is a PharmD, a doctor of pharmacy and director of pharmacy for Sierra Medical Center, talking about dosages, efficacy. We're talking about prescription medications, side effects, how to take them, not to take them. There's so much out there, and so many people take prescription medications. First of all, just as an umbrella, what is an adverse issue that you want to tackle here when it comes to taking medications?
Well, sometimes medications are used to treat a certain disease state, but lots of times they come with side effects. So what we tell patients is that side effects of medications sometimes will happen. Your pharmacist and your provider can work with you to determine how to mitigate those side effects. Sometimes it's taken in the morning, sometimes it's taken in with food, and we can figure out the best way to mitigate those side effects.
So really listen to your pharmacist's instructions when you get that medication and pick up your prescription.
Correct.
How can a patient safely manage prescription drugs at home, and then after their hospital stay, they're home, they've got these drugs, and they're like, okay, now it's on me to do it right?
Right. I like to tell patients that a hospital admission and discharge is like a hard reset on their home medications. Oftentimes you'll be discharged with a different prescription, and you'll stop taking some that you've been taking maybe for years. It's important to talk to your provider upon discharge and understand your new prescription regimen.
And when the regimen's over and we have pills that we don't need anymore, medication, what do we do with that medication at that point? I mean, just storing it in your house is the worst idea, right?
Right. So it's important to dispose of expired medications or medications that you don't need anymore. You can drop them off at drug take-back locations, and in the Reno area, there's a lot of retail pharmacies that have that service.
Okay, and then what advice do you give for safely, dosing with these medications? That's a big issue, right? The dosage itself.
Right. And I always tell patients, remember the dose, not necessarily the volume.
Okay.
Concentrations will change between, especially liquid formulations of meds. So if you remember the dose, you can always know what volume you need to do, and your pharmacist can help you with that.
And if you have, let's say as a parent, a medication for your child, and your kid 1 year has it, and you have leftover medication, it's not necessarily the same amount of drug you want to give your kid the next winter that they get sick.
Correct. Oftentimes drugs come in different concentrations, so it could be a different concentration that the provider is offering, and that would affect the dose.
Okay, and for more information, Kevin, on all this, people can go to our website, foxreno.com. Thanks for keeping us safe. That's a lot of information to digest.
Thank you.
Appreciate it. Thank you.